Thank you, Nurul. Welcome to the second day of 10th IMU Learning Resources Festival. Today we have got two interesting showcases. The first showcase, the speaker is Dr. Amal Raj Fabian, Senior Lecturer, School of Health Sciences, International Medical University. Let me introduce Dr. Amal Raj Fabian. Dr. Amal Raj Fabian is PhD in microbiology and guided several PhD and master's students in IMU. He is actively involved in microbiology teaching and research and published several high-impact publications. He is a certified professional by Microsoft in Visual Basics. Currently, he is the e-learning lead of School of Health Sciences. The title of his speech is 3D Virtual Laboratory for Microbiology Practical Skills. This is an innovation, and microbiology virtual practical of this innovation had won already a silver medal at the Teaching and Learning Innovation Festival 2022 in University Technology Petronas. The project was developed in-house in IMU by a Teaching and Learning Department in collaboration with Asia Pacific University. This is the project developed first of its kind to develop microbiology practical skills using a 360-degree 3D virtual lab. Let us give a warm applause to Dr. Fabian to start this unique innovation which he has completed in IMU. Thank you.
Oh, can I check with you whether my audio is?
Yeah, we can hear it. Thank you.
Can hear you? Okay, thank you very much. I'm Fabian. Thank you, Prof. Nilesh, for your kind introduction. So, I'm trying to share with you all the 3D virtual reality laboratory for microbiology practical skills. So what exactly happened here is that microbiology is a in microbiology, you need to do things many times so that your practical skills are better. Even for undergraduate, we have about 12 to 13 practicals because people don't get it immediately, right? So, of course, the learning process is also more complicated. And so we thought we create a totally virtual laboratory where the students can go in and work in the laboratory and increase their skills, right? So this is a totally an immersive experience. So this is done by the School of Health Sciences from where I come from. And the whole project is designed from us. And the clinical simulation skills and simulation center is the one which initiated all this. They called for a project which can be done in simulation and other things. So I applied for the project with the microbiology thing because, again, this has got an advantage. It can be used with a different type of programs as well, not only restricted to a few programs. So with this in mind, we went for this, and let me try to share you more about this. So this is the innovative 3D virtual microbiology lab. Basically, when you try to enter into a microbiology lab, there are also other softwares which are available, but it's all animated so much and it doesn't show anything which is real, right? So in that case, we want to have a very professional way where people go to a real lab and see the real things, and even the colors and other things, we want to be everything to be real, even the size. We want to use real objects so that the students will be having a very good practice on it. So, and these things are done totally on computers. So why I'm insisting on that totally on computers, if you want to run a microbiology lab, you need so many demonstrators, you need technicians, you need space, and there is a lot of things to do with biosafety because they have to work with microbes. They also work with flame or fire. Again, they also work with alcohol and other things. There are so many things, and it's also a very expensive exercise to run a microbiology lab otherwise. Again, we had a 360 immersive view, means that it is not only one side. The student can just get into the virtual thing and you can see the roof, you can see the floor, you can go around, it's a 360. Sometimes it is about 180 or 240, something like that. So they will be transferred into a totally new world. This is how they try to do it. And it's a real-time practice. So whatever they try to see in our software is that they try to see the real things, exactly like how they see it in the lab, they see that, right? And they try to get a true laboratory experience. So this is all about that. So the students can come in, get into this virtual world where they can see a very good microbiology lab, and they can see everything in real time. So they can take objects, move around, do the experiments. So this is how it's been created. So we had an objective to develop and evaluate the virtual reality laboratory skills for training in microbiology. So what we did, we developed all this, and we also evaluated with the students. That I'll be doing at the last part of my presentation. So whenever we talk about VR, we have to use certain gadgets, like we need a headset, right? So it's not only the headset, we also need some controls, which the student has to get a little bit familiar with. These days, the students are very quick learners with these kind of gadgets. So they learn it very fast. So whenever we try to introduce something new, we also have a video which tells about how to use this kind of headset before they try to go into the real program. So this is based on the real laboratory setup I've given it. So say, for example, the students will come to this particular platform, and how does he know what to be done? So we had all the instructions on a blackboard. So there was a blackboard which is created there. He can do it on the table. You can just look up at the blackboard, then all the instructions are there stepwise. It's not very lengthy, but it's all in 2 or 3 lines, what to be done next. If they just see that and just follow, they'll be able to do the experiment. And this is a very, very, very safe environment for the student to work with. So now, welcome to the VR. I will try to get into the VR and try to see how exactly it looks like. So I'll be running a short video. So I'll try to pause the video and try to tell you about this. So this is our microbiology VR project. So the 360 VR tour. So this particular VR, we have it in the IMU. And this particular VR has got about 6 experiments. So it's got about 6 experiments, which are very basics. For example, they can see these experiments on the screen, and they can choose whatever they want, right? So this is what we call it as a lobby. So they go to the lobby, they see all the experiments, they can choose anything they want, right? If they find something interesting, they do it. If they find something a little bit, they have to get more experience on that, they can redo the whole thing again. It's not going to cost us anything more, right? So the students can get into each and every experiments and try to do as many time as he wants. Again, he can take his own time to do the experiments. There is no time limit, like what you have it in the real time. They have to finish the practical within this particular time and all that, right? So the cognition when they try to do this is really, really good. So the student understand each and every step, and each and every step they don't even have to remember that all the instruction is given. You can choose and he can go on with that, right? So these are the 6 experiment which is available. So the students will be first having all the gadgets. So he'll be having the headset, he'll be having the thing, and he can just, this is a real-time experience of a student. So you can see, he can go around the room. Say, for example, if you try to turn on the right side, he'll be going around like 360. They can see how the control is, right? So they have a trigger button, grip button, the touchpad and all that. So these are the words, what we try to give it in the instruction as well. So they try to get familiarized with the gadgets, what they're going to use. So again, he can just, he or she can just, the person can just turn around, and then this is the back of the thing. And here we have certain exercises, right? So you can see there is something to be captured. So this capturing will happen to get familiarized with the gadgets, right? So So once they are familiar with the gadgets, then they can go back to the experiments and try to do it. So here, this is where they try to select the experiments. They can select the experiment, whatever they want, and they can get inside. So this is again, he can just review it again, right? And then once they are very familiar, so that they know how to use it, right? Then they can go and select the experiments. So this is how the lobby looks like. So before the experiment, a small introduction will be given by me so that they know what they're going to do, how the experiment is going to go on, and then they try to start doing the experiment, right? So they can see their hands, they can take the objects and try to work in the microbiology lab. For example, if you can see here, there are a lot of instructions. First, open the saline bottle. So this is a saline bottle, he has to open it, pick up a dropper and slowly put it inside. So this is the dropper, what you try to see here, right? So like each and every instruction is given, the student will try to take it and work on it. So you don't have to have even another somebody to demonstrate how to do things. So everything is inbuilt. He is in a different world, virtual, transferred into a virtual world. He can just look. This is a blackboard. So this is a table. So this is exactly like how they try to work in a laboratory. There's a table in the laboratory, right? They can just look into the blackboard and just follow the instruction and do all the experiments. So this is what we call stepwise instructions are given to the student. They don't have to even remember everything. If they want to remember everything, they always like kind of tensed. Oh, what do I do next? No, they don't. They can come very cool and try to work with these kind of experiments. So this is how it has been created. See, they can literally take the fluid and add it to a slide. And here you can find like people are using the flame. So they're using the flame. They can switch it on and they can heat the loop. And you can see when it is heated, it becomes red, right? Pick the loop and heat the loop. So all the instructions are given. So when the loop is cool, the red color will be gone, right? So when it is cool, again, they'll try to take the microbiology plate. Sorry. Something gone wrong. So here it's again, so they try to pick the plate and pick the microbiology bacteria and put it on a slide. Sorry. Controls. So again, they can take the microbiology part and do all the experiment. Here they're trying to do a staining, right? So you can see all the crystal violet. This is the color of the same reagent, what they try to see it in the real time. So they can take it, and the timing is also given. You can see the timer going out behind that, and they can do a washing. So they can open the tap, bring in the water, and they try to wash the slides as well, right? Again, they have to wait for 60 seconds, but we don't show the 60 seconds, but the timer will run only for 5 seconds. After the timer, then they'll be going to the next step to take another reagent and do a gram staining. This particular experiment is done to see how the bacteria look like under a microscope. So when you try to do a staining, you can see the color being imparted to the bacteria. So they try to do all the experiments. So once they have done, it says, congratulations, you have completed, right? So this is like one set of experiment is over. Now the student is happy. So he goes to check another experiment. This experiment, something here also, he's going to use a loop. He's going to use a saline. So you can see that he has taken the bacteria and put it inside. And these are micropipettes, which they try to use it for different type of experiments. So each and everything is given there. Again, you can see a green color mark in which where they have to add the reagent. And all the reagents, the color and everything is reproduced exactly like what is in the original set. Sometimes when they try to add a reagent, it will change the color. So even that is depicted in our software. So the color change can be seen. And once the experiment is done, they can always compare it with the results. So this is another advantage. They can also use a pencil and try to mark, right? So there is a scoring sheet where they try to do a marking. So once the marking is done, then they can always find the answers. So they can always check the answers. So if they want to really check the answer, they can see where to reveal the answers, then they can check it. Then they exactly know how, whether it is right or not, right? So this is how they can also review the experiments. And not only that, the students found it very easy to do all these experiments. Okay, this is another experiment where they try to take the bacteria and put it and see whether the bacteria is motile or not. when the bacteria moves motile, it will try to move from one place to another place. And the same experiment can be demonstrated in 2 different ways. So we put the 2 different experiments also here. You can see this is a experiment where we try to place a drop of a bacteria and put it under the cover slip and try to see it under the microscope. You can see the bacteria moving. Here we also have a microscope where they can put the slide and view the bacteria, whether it's moving or not. We have the animation for moving, and this is a bacteria which does not move, it doesn't move. So we don't have any animation for that. So the students' experience is that they really enjoy this. So they go to a virtual world and try to enjoy doing all this. And this is about our project, right? So, okay, going to the next slide. So we tried to do, we developed a particular project, and we want to know whether the students are able to gain some knowledge, right? So what we did, we tried to do a pre-test. Before they try to do the experiments, we tried to have a questionnaire. The questionnaire will have the relevant questions regarding the experiments, whether they have some knowledge on this or not, right? So the pre-test questionnaire is tested with all the students before they try to do the experiments. And the post-test, after they try to use the VR, we also give the same set of questions to them and see whether there's an improvement or not. So this will try to tell exactly whether this particular tool is effective or not. Right. So what we try to do here is that we did the pre-test and the post-test. So if the pre-test, the data is in green, the post-test, it's in purple. So if you try to see the purple, it has got a total skewness towards the right, means that people are able to score well after doing this particular experiment, meaning that the cognition, even the skills to do the experiments are really good. They also remember things better, right? So this is a thing we got from based on the knowledge. Again, we have to get the perception of the questioner. We try to bring something new. There are new gadgets, we can train them and whatever it is like. So it took some time, yes. And we have to get the perception. What do the students think about this, right? And overall, the students were very enthusiastic and they come and do it in groups, right? So they come and do it with the groups, even with the peers, there is a lot of fun. Somebody does something wrong, then there's people who used to laugh. So when they come into this kind of environment, they find even it's a fun kind of learning. And if somebody is going, is like, it needs help, immediately comes from the peers. So these are the things which happens in the platform. So when we try to look into the perception, so they said if you try to look into that, the orange color is a neutral, and disagree is green. So we don't find many places where people will disagree. If you try to look into that, there are very minor issues, but they don't have much confidence, meaning that something new, some people need some more time to do it, yes. So this is very natural. So all these things are reflected, but most of the results are very positive. So here we also define the learning objective very clearly, and people are also tell that this is easy to access and easy to use and easy to navigate. And so they were very happy, and they were able to understand the procedures very well. Because even when we try to give a procedure in the lab and try to tell them and do it again, they have to refer that so many times. So it's a kind of things which are made easy in this particular platform, right? So, and they help this particular visualization help because they see things, they try to do there, then the experience was always better, and they can their recall knowledge is also better, right? And each and every step they were guided through, they liked it so much, and they say definitely it helped them to learn the procedures very much. And if they try to do a mistake, of course, like they can look into the board, they can see that probably they missed something, they can redo it again, right? And they also said this was very engaging, because when you try to put on this 360 immersive, you don't see anything else. You don't see anybody in the outer world. You're in a virtual world where you see the laboratory, you see the things which are there. So it is very engaging. And everybody agreed that it's simulated the interest rather than the routine mundane things what I've been doing for years together. They come and do something totally different. It's really nice for them. So that's why they say they stimulated the interest, and they build a lot of confidence. And some people, of course, learners are very different kind. They have to take some more time, and they feel very safe to make mistakes. In a real time, if they try to spill something, It's a biohazard. It has to be clean. It has to be reported. It has to be documented. So many things are there. But here they felt very, very safe to work in this kind of environment. Because microbiology lab, even though when I was a student, I entered it with a lot of tension because it's a microbe, there's a fire, there's alcohol we have to use, and things can go wrong, right? So so they try to do the ultimate thing is that they say they try to work with their own peers, which is always fun, right? So these are the perception what we got from the students. After that, we also did a focus group discussion, right? So what emerged from the focus group discussion overall, they said it is interactive and very interesting. And the steps are very clear. They liked it because, and it's motivating. So they're just in an immersive environment. Whatever you see, it is there for you to do the experiment. Is really motivating for them, and they understand the procedures better, and it is very encouraging for them. They retain the information. That's very visual communication is more effective than verbal or reading and other things, right? So they retain the information very well, and there's not only talking about the positive things, but there are a few things where the student has to learn a little bit, took some more time, is that sometimes the people find the controls to be a little bit difficult to handle, but over time they were able to get over it, right? And because it is a 3D, when they use it for more than like 20-30 minutes, they can feel a little bit thing, so they have to take a break, give it to their friends, and then they try to do it. So, and this experience with the students has been really, really, really good. So all the students can achieve the practical competencies. So meaning that anybody, be a slow learner or a fast learner, everything and everybody has an equal opportunity for all the learners, and the pace of the learning is not restricted. Some people learn slow, some people learn fast. They can come back again another day and also do that, right? And this is a personalized learning experience. Somebody is really very personal to you. In the screen, you see that communication, whatever is there, you try to work the way however you want. And this is a very, very, very safe space, especially for a microbiology laboratory where there are so many hazards, including biohazard and fire hazard, and as well as chemical hazards, right? So, and this engage any kind of diversity of students, right? So, again, it is very cost effective. We don't have to have demonstrators, and people can do it many, many, many times. So this is a total space where the people come and enjoy. So, and again, let me conclude that this study was supported by International Medical University as a faculty project for me, and it was funded by IMU. And we had the grant collaboration with APU, and all these things was made to happen through the CSSC, which is a common platform which will enable the faculty do things and get our collaborators and make these kind of things come true. And we are very happy to have this. If there are any more questions, I'll be more than glad to take it. Thank you very much. Thank you.
Thank you, Dr. Fabian, and congratulations to you and the team for winning Silver Award in Teaching and Learning Innovation Festival in University Technology Petronas.
Thank you, Doctor. Thank you, Prof. Nilesh.
Actually, when I used to do this gram staining during my college days, my personal experience was always missing the steps. So did any student tell that they could miss the steps during this virtual practical?
Yes, they cannot miss the steps actually, Prof. What they do, each and every step is given, right? If they are trying to miss something, if something is not working, again, they can see to the board, they must be misread the information. Again, they read it again, they do it properly, then everything is there. Even like taking a pipette, every small details is very, very given there. And everything looks exactly the same like what they try to use in the laboratory, the color, everything. And even the microbiology plates are also marked with the bacteria and other things, like if you try to watch it very closely. So they find everything. That's why they say the learning experience was better. They can remember the procedures because they don't have to search anywhere. Just look into the board, that's all. They have all the information. So all the small information, we also put it on the board.
So when they actually go to the practical, did you find that it improved their skills?
Yes, definitely. They can remember all that. If you go to the practical and give a demonstration, usually the students it's very confusing. So now they have seen something virtually, how it's been done in an exact laboratory situation. They can come back and even the time they try to finish the experiment has become a little bit earlier. This is my personal observation. if a student is going to take about like 20-30 minutes to finish 1 or 2 slides with gram staining, now he's going to be able to do it in like 10 to 15 minutes. He knows what to do next, the timing, everything is given. And even with the lab manual, because of the cognitive knowledge, he's able to perform better. And again, somebody who can do better, again, they start helping their peers as well. So even within the group, like this has been like kind of like they can, everything is set in their mind. They know what to be done. So they're very confident coming into the lab as well.
So how many students actually completed this virtual training and then
this
went
was
back
completed
to
by about
microbiology
a strength of about like 42 to 44 students.
So all these 44 students, when you observed, they reenacted this in the microbiology practical room.
Yeah,
so
yeah,
you
but,
find out,
but not all the 44 did before, because like when we start the semester, some did before and some did even after the practical exam, after performing the practicals. So because we have about 13 set of practicals in microbiology, and each and every skill set will be learned here and there, right? Not at one practical. So they found it very useful to go back to the VR with their friends and try to do things, because they cannot do the same thing in the laboratory. We don't have space. We don't have time. We cannot have another setup for a laboratory. Even for lecture, we can just take another lecture if somebody has got a problem. So this has solved a big gap, especially with the laboratory skills, where they can just go into the CSE, do practically with their, again, they do always with their friends. If
I am clearing this, that means this 44 students who have completed in virtual lab, actually speaking, when they go to microbiology lab, individually, they do not have the ability to do the test. They usually do in groups.
They do it in groups, yes. Even for a particular bench, there'll be 4 to 5 students. They have to work in groups. Yeah, but the individual skills will be, we also do a skills assessment in our microbiology practicals, and about most 99.99% got 100% marks in the skills.
So there is one question from Prashanti Sri, that how do you know that did you able to assess them during this virtual practical session, because the students are actually doing alone using the VR headset?
Actually, we have a pre and post questionnaire on knowledge just for the VR. Actually, after the VR experience, this is like we have to do one more study later, maybe with other batches. So this is our first study, what we did with the students. We can see a lot of improvements. Maybe we'll try to put that as a parameter and try to set another batch so that we can do more observations from the other batches.
And there is a second question from Ajma Abdul Hamid, that how long does it take to complete the 6 module for average student?
Okay, this is a very good question. So usually the students will come in a batch of 4 or 5. They book for about 2-hour session. So each student will have about like 20 to 30 minutes to do the experiments. Initially, they have some problem. They'll be doing it slowly. Once they set in, then they can do it very fast. It takes about half an hour for a student to do the 6 experiments. If you become an expert, you can do it in like 10 minutes, but it takes about half an hour to do. And some people, they do it very fast. It was very surprising. Somebody came in, even for the first time, they were able to do it very nice. It all depends on the psychomotor skills of the person. Also, them getting used to the 3D virtual environment. If somebody has already got used to the environment, they do it very, very, very fast. Very surprising. Again, they can take their own time, because we give about 2 hours time when they don't have classes. So the CSS is open for them to book. So they can book and come in and then do it. And we also have a Darshan, who's a technical person there, who is ready to help with the setup and other things and give it to the students. And he also knows how to operate these things.
And the last question is from Mr. Hasnan, that
yes,
when you have these challenges in designing AR content, I know that I have been with you and all, there are a lot of challenges. So how actually you could take the planning, and what are the steps you would do to overcome?
There will be a lot of challenges. Probably I had some little bit of exposure to computer, but also with Visual Basic. I personally went to APU on weekends as well as on Raya holidays and other things. I was with the students because the student, they don't have an idea because they are engineering students. So I have to go and sit down with them for about like 4 to 6 months. And yes, we have to be with the students. We work closely. Then the outcome is really, really good. First, I just accepted whatever they did. Then I have to go and talk to them because like virtually, we also should have a video which is placed, which will try to look into the 360. And sometimes the angle has to be the right. Again, we also use the gravity. If they try to shake anything, the fluid will also shake. So we incorporated so many things which will be so realistic in this particular software. Again, the students, when I try to talk with the students, there are more things which came out. Even for the tap water, it came something like a pyramid. So we have to even shape that properly like a tap. And again, switching on the flame and switching off the flame, we made it possible. And when it heating and other thing, that was quite okay. And they can also go around the lab. They can just walk around the lab virtually. Right. So these things are also made possible, which was more exciting for the students actually. Actually, I personally worked very closely with the students who developed the software. Probably I could communicate in the words with the computer language so that they do it better.
So I know that there was some spelling mistake, but I do not know what Firdaus is asking that.
No. That
if suppose there is a mistake,
when we ask the student to create it first. So if I try to interfere in them right from the beginning, it's not a good thing. There will be mistakes, then we'll sit down and correct it. Now we don't have any spelling mistakes, right? So these are smaller things which have been corrected later. Yes, the spelling mistakes were there when we immediately created it. There were some grammatical errors. Yes, the student created it. Then we are back. Then we have to sit back and do the QC. So Dr.
No, is there any missing steps? And they missed it, and then you identified it and they had to redo?
No, there are so many, even for giving the instructions, we do not know first like how to give the instruction. We thought we'll put it as a marquee, meaning that the text will come from one side. Then later we tried to use a board. So this was also suggested by the students. Then we use a board. So when we use a thing, again, we have to use the text colors to emphasize what is to be emphasized. We have used a red color. We highlighted the word each and so these things took about 6 months to work with the students after the software is created 80%. So we have to very, very closely work with the students directly. Again, so when I get the software, I'll bring it to IMU and just run it. So people tell this is something has to be improved. I take all that. And when we finished it, so we have now we have no lacunae. Everything is perfect, means like it works well. There are no spelling mistakes, no errors, no grammatical things. And even some of the things we're not able to grab, everything has been sorted out. And this can be, so even though somebody has got no facility for a complete microbiology laboratory, they can use this software and give a very good experience for the students. Even the color and everything is exactly the real color.
So what is your comment on those students of APU who have made this possible?
The students were very cooperative, but even it also depends on how well we try to move with the student. I cannot like command them. So I have to be very friendly with them, get the work done in small chunks. Even though I have 20 things to be modified, first I'll take the most priority things, only 2 things, sort it out. Then I encourage them. Then I give the 3rd and 4th thing. So slowly it's a kind of a working relationship we have with the students and make it happen. If I tell you developed, I got about 20 things to be done. No, that's not the way how I approach them. So I tell them even in their own language. So I tell that it has to be done many times. It has to be iterated, and so many times the speed has to be reduced. So we try to do that. Sometimes the video has to be the angle of the virtual video. We also have a virtual video camera there, because what you try to see is a virtual video camera on all this. Right. So the placement of the video camera virtually is also very important. Otherwise, like it has to be correlating with the VR lens and all that. So the position of POV. So the position of view is also very important, that we have to correct it many times. So if they try to look in here, they should not have any other things coming in. So there are so much of technical aspects. Probably I had some exposure with that. So it was very, very useful directly working with the students.
Thank you so much again for.
Thank you so much.
I think we have been all very much benefited by your sharing this innovation which have been done in IMU. And
that
I
was the
hope
last
that
question. Yes, they can redo the experiments many times.
yeah, many students will be continuously being benefited for years because of this innovation. And this is something really unique that once this is done with your all penstocking
Actually, this is
experience,
a
you can
2-year
continue
project,
for
Dr.
many
Nilesh,
years.
Prof. Nilesh.
Yeah, yeah.
So we did it on time.
Yeah,
And thank you for
so much.
everybody's cooperation. We had a fantastic team as well.
So let us all give a warm applause to Dr. Fabian, and let us now move to the next session. So I now introduce our next speaker, Prof. Dr. Arshad is Associate Professor in Surgery Department of Clinical School of Medicine, International Medical University. He is also Head of Division of Surgery. Prof. Dr. Arshad is a practicing surgeon and received his FRCS degree in 1988 and also completed a certificate in medical education from University of Dundee. He is presently looking after construction of virtual medical clinic tools in Clinical School of International Medical University. For those who may be wondering what is virtual medical clinic, it has been actually a tool where several clinical cases are put in virtual platform to be used by students in the clinical phase of the program as formative practice. And we have been doing this since 2016. So now these cases are hosted in eLearn portal and integrated in curriculum. So let us give a warm applause to Prof. Dr. Arshad. The title of his presentation is Virtual Medical Clinic. Thank you.
Thanks very much, Prof. Nilesh. Let me share my slides. Okay. I hope everybody can see.
Yeah, we can see.
Right. Okay. So the title of my talk is Virtual Medical Clinic. And so this is a link which is given for our e-learning portal. So what is Virtual Medical Clinic? International Medical University.
Prof. Arshad, can you put in slideshow mode? Slideshow mode.
I put it, yeah. This is the slideshow mode. You can't see this?
You can start
Okay.
reshare again because we cannot see slides.
What about now? This is in the slideshow mode.
Prof, we are seeing still your PowerPoint application. So maybe you need to reshare different screen.
Okay. Right. Okay. Let me see now. What about now?
Perfect now. Yeah.
Okay. Okay. Right. Okay. So what is a virtual medical clinic? So virtual medical clinic, International Medical University introduced a virtual platform by transforming educational technology into learning when access to the clinical environment was limited. So it's a unique, effective education method that provides a positive learning experience when the access to clinical teaching is restricted. So clinical cases were prepared using latest e-learning tools such as Articulate, Storyline, 360 or beyond. So far, we have prepared 43 cases and these were prepared by different disciplines. Due to disruption in education, we were forced to use new technologies. And fortunately, we already approved this project before the COVID in 2019. This case was approved, but the project accelerated during the COVID time. And this is our virtual medical clinical team, which help in preparation of all the cases. Me and Mr. Fazil, Ms. Aida, Mr. Hasnain, Prof. Nilesh, and Dr. Sunil. So if you define by the definition, so it's a medical clinic is a virtual visits that take place between patients and clinicians via communication technology. The video and audio connectivity that allows virtual meeting to occur in real time from virtually any location. this is how it looks like. Like this is a case of a deformity of foot. So we prepared using the animation and technology, and it is interactive. This is a QR code, and the student can access anytime at their convenience. The VMC or virtual medical clinic dashboard looks like this at IMU e-learning portal. These are the disciplines which participated in creating different clinical cases. Department anesthesia, emergency medicine, gynecology, medicine, orthopedic, reproductive surgery, urology, and drug prescriptions. So this is our statistics from 2019 to 2022. These are the attempts. So when look at the graph, how it is going up gradually. Even the COVID is over, but students are benefiting by accessing these cases. In 2019, look, 105, 2020, 350 attempts, 2021, 882, and 2022, so far, 1,212 attempts have been done by the students. And this is just a summary of the cases. You can see the cases are like sudden chest pain, 194 attempt, child with fever. So all different, these are the topics from the different discipline. And these are the cases which in 2021, the student access to these cases. And in 2022, these are the list of the cases which student access. And you see the all different specialty, the pediatrics, ENT, and see the 74 unpleasant. This is the ONG, fracture, elbow pain, orthopedics, 43, back pain, elbow injury. So traumatic, this is the quite number because this is a quite common case in Tunku Jafar Hospital, Sirumban, traumatic hip dislocation. So these are different specialties who put up the cases, and the students, these are number of the attempt they have access to the IMU e-learning portal. And we got a very good feedback, very encouraging feedback. That is looks great, creating a learning resources there. And we also took seriously about their feedback. Like most of the students, they said the cases should be more longer, more questions, more active. The longer case may be more complex one to really challenge our understanding. So this is a good on the basis of the further improve our VMC cases. So this is how we started with the case, give the little history. You can see the from history, then come to the diagnosis, and diagnosis mean the clinical as well as by investigation and what's the management, and this is how. And during this there are interactive questions, and without that attempting, you cannot move to the next slide. So this is quite interactive sessions of the, and it involves the basic science and knowledge also, anatomy, physiology, so also involved in this. So it's a complete case. So this was till now. In 2022, IOMI in the process of digitalization. So what we existing cases, what we had, so we further in 2027, we enhanced, and we use all our new technology, new method. So how to improve further these cases, because the students, you can see the number was going quite high, and the students were benefiting from these cases. They can see the case before going to the ward, before going to the clinic. So they can access those cases while sitting at home. So what we did, peer role play. This is a novice modality of virtual teaching, which can nurture a hybrid experience of learning. And we started this case, the first enhancing we did in orthopedics. So orthopedics, they come in the 4th year and they come for 7 weeks posting. So what we did, we use a peer role play. So for orthopedic teaching learning, a virtual clinical case is designed in which students play the role of patient and the clinician to imitate clinical scenario for effective experiential learning. The recording of a complete clinical case with the inclusion of quizzes to make the session interactive is available for the student to access via the IMU e-learning portal for self-directed learning. So what is this exactly? What is a peer role play? So we utilize the David Kolb experiential learning cycle, which he described in 1984, that you act, then you experiencing, then you recall, reflect, and think, and this cycle goes on to improve your experiential learning. So what is inventiveness in this case? So peer role play give insight into how you react in clinical situation. The students are playing the role of a patient and the doctor, and their peer are watching this online. So they give you insight how you can react. It also further give you critical thinking. How can you improve your skills? And then in the end, you can reflect whatever you have seen and discuss with your peer. So peer role play is an effective education method. It gives inside the clinical case. It provides a positive learning clinical experience. It permits critical thinking and prepare students to deal patients in the real clinic. So what is the practicality and usefulness in this case? So you can see on the left side the learning outcome. So this is a case what we prepared for the enhancement is a case of traumatic dislocation hip, as it is very common in Tunku Jafar Hospital, Seremban. So what's the learning outcome? We describe very clear learning outcome that the clinical finding on at the end of this case, the student should able to demonstrate clinical finding on a physical examination. They should able to list the type of hip dislocation. They able to describe the X-ray. They can able to tell the emergency treatment and can tell early and late complications. So this outcome, this is the complete case. If they go through from first to till the beginning or till the end of this case, they will be able to demonstrate all this outcome, and this means their complete knowledge of a case. And you can see they're quite interactive. So interactive means you have to answer, otherwise it will not move. And in the end, you can check your answer and you can see the correct answer also. So like this, so we recall the anatomy. As you know, the dislocation hip, the anatomy is a very crucial to know anatomy. So now, and this is how it works. So this is dragging. Without it, the slide will not move. So this is a complete recall of anatomy. The students are able to drag the answers. They can drag and they can check and then look. Now they have to answer this. So they have to answer this like this type this sliding now, which is very important to know about it. Next, okay. So now this is a case of a traumatic dislocation of hip. So this was prepared with 3 students. 2 were acting as attending emergency doctors, and third played the role of a patient involved in the motor accident. In this case, emphasis was given to improving communication and psychomotor skills. The quiz about the anatomy of the hip, clinical examination, investigation, and management was included. The recording of the whole case was done and uploaded at the e-portal. So now I will show you a brief video which will demonstrate.
I understand that you are in a lot of great pain right now. Yeah. Is it okay if we take a look at your hip? Sure. Yeah. So I'll be lifting this cover off and we're examining the hip. Okay? Yeah. So Mr. Hashim, can I take this off? Yeah, sure. Okay, Dr. Brian, what do you see over here? One infection that's bruising over the right knee, as well as the right foot. Right. The posture is also abnormal as well. The knee is flexed.
So, Prof. Arshad, we cannot hear you.
Yeah, no, I'm not just showing the video.
Yeah, sure. So on inspection, you see there's a mark bruising over the hip. The entire leg is also short.
You can't hear the voice?
No voice. Doctor, you need to reshare again with sound. And could you please move your mouth, the mic bit far from your mouth?
Here. Okay, yes. Okay, so
Okay, Mr. Hashim, I understand that you are in great pain right now.
Yeah.
Is it okay if we take a look at your hip?
Sure.
Okay, huh? So I'll be lifting this cover off and we'll examine your hip. Is that okay?
Yeah.
All right. So, Mr. Hashim, we'll gently take this off.
Yeah, sure.
Okay, Dr. Brian, what do you see over here?
So upon inspection, there's clear bruising over the right knee, as well as the right gluteal region.
All right.
Yeah.
The posture is also abnormal as well.
Yeah.
The knee is flexed, with the hip also adducted. And the hip is also flexed partially.
It appears to be also internally rotated as well.
Correct.
So, Jason, let's summarize the findings.
Yeah, sure. So on inspection, you see there's a marked bruising over the hip and the knee. The entire limb is also shortened, and the knee is partially flexed, right?
Not to forget as well, at the hip joint, it is internally rotated, adducted, as well as slightly flexed.
Correct. Okay.
So, Dr. Jason, what do you think of the diagnosis?
It looks like a posterior dislocation of the hip to me. So we shall test whether the sciatic nerve is involved or not. Okay.
okay, so you see that it was a complete physical examination. So we have demonstrated in the video, in the peer role, all history taking, physical examination, management, and we put in the virtual medical clinic the video recording of all peer role. And this is our feedback from 71 students. We did the survey, and you see that, and all they agree that they can visit at their convenience anytime. The quizzes in the cases make interactive and enrich insights. So all these you can see very clearly. They're all very encouraging and positive survey. The students reply, 71 students, we did the survey. And as I mentioned, that this was shown to students who are doing the clinical posting in orthopedics for 7 weeks, and they are in semester 7 or 4th year. So in conclusion, peer role play in a virtual medical clinic cases provide an excellent platform for experiential learning, fostering high-flex learning and learning innovation. It prepares students for the real clinical setting. Thank you very much.
Thank you, Prof. Arshad. I think he took pain, even you are not in Malaysia, he took pain from far away, and still there are some sound problem, but it's okay. I mean, we could understand, maybe the mic was some sound having. So we will take the questions later on, and we'll quickly invite Dr. Afshan Sumera. Dr. Afshan Sumera is the head of pathology department in the International Medical University, Malaysia. She is the e-learning lead for the School of Medicine at IMU. She holds a PhD in hematopathology. She also completed a certificate in medical education from University of Dundee. Particularly, her work has been involved in several e-learning projects in IMU since 2012. This particular project is on virtual reality-based learning development and evaluation of a virtual reality experience application for undergraduate teaching. For all of our participants, this web-based virtual reality experience is having a new experiment in IMU, which can be seen by the student without using headset. And this has been initiated by Dr. Afshan's project. So let us give a warm applause to Dr. Afshan, and the floor is yours. Thank you.
Thanks, Dr. Nilesh. I hope my voice is clear, and also I need to share my screen. My slides are visible?
Yes, visible.
Thanks. Thanks for nice introduction, and because we are already running short of time, so I would prefer to go to my presentation directly. So this is what we have to show, that what we actually created a new learning area or learning environment for students. So the project title is Virtual Reality-Based Learning, Development and Evaluation of this VRX application for undergraduate teaching. So for my team, which includes Mr. Mohammad Fazil, Mohammad Aswandi, and Prof. Nilesh. So a little bit background that why we need this type of virtual environment. We know that 2D images are important. They can give idea about the content, but 3D is proven that it's more essential than the 2D images, than these traditional methods. And also we see that over time, there are advances in this HCI or human computer interaction that have changed many parts of our life. And also we can see the great examples during this COVID time. So in recent years, actually, we can see that VR technologies completely changed this SCI field. And also we can see that it has provided new and innovative perspective. So this is what, based on this background, actually, we created this environment, and objectives were, you want me to share my laser pointer? Okay. I know I cannot, I don't know, there is some issue. So objectives were to develop an VRX-based application on red cell production. This is how we started with for undergraduate teaching and learning, and also to determine the perception of students regarding this new application. So we use a validated questionnaire. So for inventiveness of this project, we created this 3D RBC module for all these actually what you call it, the different differentiation stages of red blood cell production involved. And where actually we use this Mozilla Hub, which is free to use, and it's a virtual collaboration platform where student can enter and can first they see how they can control and how they can use it, and then they can move to RBC module. That is the first module we have created, and we plan to create more. And also we can see that some introductory video on erythropoiesis that actually show the full erythropoiesis first, and then they can move to 3D models of various stages of red blood cell production, and that with the voiceover, and also they can actually, the text is also displayed. So both ways they can actually see, they can hear, and also they can see. So with that, actually, also we used the validated questionnaire, and we took the feedback from biomed, dentistry, medical, and other students, and total 57 actually students participated in the feedback. For the practicality and the usefulness, we can see that why it is important to know this, because I'm involved in hematology module, and we where I feel that before going to know these different disease processes involved in red cell, they actually should be clear with the production of red cell. So production of red cell, this is what I believe that should first step to understand the difficult concepts of anemia and other concepts. So this is how we started with. So we created, with the help of e-learning team, actually, they created these 3D models for red blood cell. And this is what student can see, and they can actually understand, because we believe that seeing is believing. So this is what they can actually see. And also this application allows the student to, they can use it at their own convenience whenever they want, and that can actually promote the personalized learning also. What will be the impact on learning? We see that it can be useful for biomed, dentistry, medical, biotech students, and they can learn easily on their own time and conveniently this RBC production. And also this application can give them ability to or access student to identify these different stages of red blood cell that can be altered in different disease processes. So for this 57 students who participated in the feedback, we can see that majority of them believe or strongly agree that this application was useful and it was easy to use, and also they felt that it was they were comfortable using this application. So we received actually very good feedback on all these different aspects on the usability and of this application. So like also they felt that it was simple to use. For future plans, we actually plan to have white blood cell production and other cells production also, and then we will move to introduce some cases related to these alteration in the morphology of these blood cells. So this application, as I said, can be useful for these different undergraduate programs like MBBS, biomed, biotech, or dentistry also, where they are involved in learning of hematological diseases. For 3D modules, like I said, we will add more for the other blood cells in future. So this is how, this is the interface of this application on Mozilla Hub. So this is how students, when they enter, they can see the controls and they know how to roam around and how they can navigate this application. And all before that, they can actually have overall view of production of red blood cell before they move to individual stages of differentiation. So where they can actually see these different stages, and with audio and text is also available. So that can actually enhance their learning. So all these different stages, and also when they click, they can easily see that how nucleus is ejected at some stage of red cell production. And that is also actually captured very beautifully in this application. And then they can see and move to the final stage. Also, they can actually complete the knowledge check, which is also available according to these different stages. So they can check their knowledge, that what they gain after going through this, and then they can actually give feedback. So this is how this is short video which can show you that how it looks when they enter. So this is a 360 view. So after watching the video, they can move to these all stages, like started as pro-erythroblast with audio.
Large round nuclei with open chromatin and many small nucleoli. A rim of weakly basophilic.
So you can see that that is stage where the nucleus is ejected from the immature red blood cell. So all these stages are actually shown there. And then after completing this activity, they can actually have the knowledge check. And finally, if they want, they can give feedback. So this is how they can see there, and this is the feedback form they can use on, which is available on eLearn. Okay. That's all from my side. This is what we have created. I'll be happy to take your questions.
Yeah, can we have Prof. Arshad? So I again thank Prof. Arshad because you are traveling, and during traveling also you are touched with me, and we are really grateful that in spite of traveling, you could present. So we can see the diversity of School of Medicine in these two presentations. On one hand, Dr. Afshan presented on mainly on basic physiology and anatomy of red blood cells, and he has planned also to go later on into hematopathology of RBC related disorders. On the other hand, we can see that how clinical schools have been implementing this virtual medical clinic experience. And as Prof. Arshad already told that the students actually are quite benefited by this. So my question to Prof. Arshad first, that we are really delighted that you have been involved students and the students acted as a doctor. Can you tell us this experience, how you started working with the student, and what are the difficulties you faced, and who are the people who actually helped you in this total process?
Yeah, thank you, Doctor. Yes, currently I'm in California. I just reached last time. So yes, when I showed the original cases like distribution hip to the students, so they were asking about the clinical examinations. Prof, how can we? Your examination is so important, the psychomotor skill, but is theoretically and interactive is okay. But then I realized that if I put this peer role and a role play, that will be very useful. So I discussed with my mentees, and they're also very enthusiastic to act as a patient and the doctor. And then we have a very advanced e-learning department. So Ida did the videography in clinical campus. Mr. Fazil, he did all the animation. So it was a very successful experience, and this was the first case, and this case was as a model case for the other specialty. And I'm happy to tell you that another from the emergency department, Dr. Asad has created an excellent on the CPR, another case already prepared. So we are encouraging all other departments to come up with a role play idea, so that the student can get benefit more clinically, and the really case become more clinically oriented.
Particularly, my question, Professor, was because during last IMAC, I presented my experience of working with the student about new curriculum, the cardiovascular anatomy. The students, 4 students helped me to present, and particularly we got feedback from Ronald Harden that it was really very, very important for students as they actually come forward and they prepare curricular content on their own. And that is actually, even in AME and other educational bodies are increasingly coming on this concept. So how do you think that if the student make the curricular content, how does it help all of us?
Yeah. So involvement of the students is very important, because these are the really our stakeholders. They go to the clinic, they go to the ward, and they have what exactly they are looking for, what's their expectation from us. So that helps. That's why that helped me also to put this into the role play into the clinical case. So involvement, yes, I totally agree with you. The involvement of the students in the different aspects, like curriculum development and this virtual medical clinic, is very beneficial to the both to the faculty as well as students. So now we are going to involve in all clinical cases of the what is currently on our e-learning portal. The virtual medical clinic will involve all the students in this to make up more clinical.
Yeah, I think one of our participants also corresponded, Ajma Abdul Hamid, that involving students give us the content from their perspective, thus it can help other students understand better, because the way we actually present as a doctor or a teacher and the student present somewhat differently, and when the students see their own voices being echoed in their curricular content, they are more engaged. So do you find that when you are talking with this student about preparing this, how they will take the history, did they take on their own, or whatever you told, they just repeated?
So what happened once I told them that, okay, you will be the actor for this case. So they gone through the case thoroughly on their own, and then they come up with, okay, these are the important cases in the history examination. So I just summarize them to fit in the time. Otherwise, they prepared on their own. They did the thorough study of on this case, anatomy, the clinical finding, X-ray, all management, and they come up, and I just help them to summarize to put in the time frame.
Thank you so much. Now my question to Dr. Afshan. Dr. Afshan, there is a question for you in the chat box that can you please share about the source of funding for the projects? Dr. Afshan, can you hear me?
Sorry, I was talking to myself. Yeah,
So,
for this project, actually didn't cost a single penny for us because we use e-learning team, and it was very nice of Mohammed Aswandi and Mohammed Fazil. Actually, they helped with the creating all these 3D models. But maybe in future, because we are planning to enhance this project and also expanding this project, so maybe then we need the funding. But I can talk about IMU, because IMU, if we need the funding for projects, actually we can apply through JC in IMU, but I'm not very sure that about the external funding. Maybe Prof. Nilesh can briefly talk about that thing, but I'm not very sure about the external. But within IMU, can you hear me?
Yes. Yeah, I think the process is like that. We make a joint project to the IMU JC, and nowadays IMU JC is very liberal. That previously the staff project they did not used to give this RA, research assistant, but as we are increasingly involving the student into our project, and student requires some money, so they have able to agree that this type of project, if it is 20,000 or 25,000, out of that at least 3,000 we can put for RAs, and this RA fund goes to the student, and you have to take the receipt and all, and the invoices to be raised and sent to the finance for payment. So I think that is the progress, that even in the staff project for IT based project, we can have RA funding, and that one can be given to the student. In that way, actually, we manage the collaborative work with APU, because in APU work, mainly what Dr. Fabian presented, it was done by final year student of Asia Pacific University, the engineering students.
Yeah, for collaborative work, actually, we can have some projects, then we can actually think about, but in IMU, we have another education funding also, where we can get funds for some education projects also.
So Dr. Afshan, actually, how the students interacted? Did they went individually into the Mozilla Hub? And can you please explain us how students interacted?
Actually, first time I introduced them to this Mozilla Hub, and within group, actually, I showed them that how to navigate and how to enter room and all these things. But after that, when I asked them for their feedback, individually, they went through the Mozilla Hub and all these steps, and then they provided that feedback. And overall feedback which I have received is that is easy to use. It's not difficult, because we don't need any gadget or a special gadget, actually, I would say. And it's just you need laptop or your phone where you can access this freely, and there's no cost involved. So they like the idea, actually, but because this is quite basic, which we started with because we wanted to check that it is helpful or not. So at this moment, this feedback was actually quite positive.
Thank you. I mean, with great effort by Dr. Afshan, and can we have Fazil here? Is Fazil in the session? Mr. Fazil?
Yeah, a big thanks to Aswandi and Fazil.
Yeah, Mr. Fazil is Mr. Fazil in this session? Mr. Fazil, can you open your camera? So actually, we were experimenting with certain open source because open source does not have any money involved. So luckily we got this Mozilla Hub, and with Dr. Afshan and this team's effort, we could actually implement it. And we want more people to apply and interact with us so that we can put forward this project forward also, so that with very little involvement of fund, we can prepare this project. And sometimes it do not require even the VR headset, because the student can see in their laptop on their own. So with this, we end this session, and we are very, very thankful for Dr. Afshan and Prof. Arshad for sharing their experiences. Thank you.